Dan Shook. I'm the Chief Financial Officer for Franklin County Children's Services. Our Intake Program Director, Laura LaRoche, and our Inclusion and Analysis Director, Tanya McClanahan, will be joining me today in today's presentation on behalf of our Executive Director, Chip Spinning. To begin, I would like to express my appreciation to the County Commissioners, County Administrator Ken Wilson, our board, staff, alumni, volunteers, providers, partners, many donors, and community members for your continued support of Children's Services. Franklin County Children's Services mission is, through collaboration with families and their communities, we advocate for the safety, permanency, and well-being of each child we serve in the manner that honors family and culture. We accomplish this mission by providing community and home foster care, adoption, and youth transition services and supports to Franklin County's most vulnerable children and their families. Generally, the agency receives more than 29,000 referrals, completes approximately 13,400 intake-related assessments, and serves more than 9,500 children and youth each year. Daily, there are over 5,500 children on open caseloads, where more than half of these children are served in their own homes. As it has been said, it takes a village to raise a child. Well, it takes much more than that to support the children and families and the community in Franklin County. This support consists of over 794 employees, more than 100 agency and organizational partnerships, approximately 500 kinship families, 132 adoptive families, 195 active volunteers and mentors, hundreds of community foster parents, and thousands of Franklin County property owners. Together, our community partners and our staff are vital to achieving our mission. Child welfare is a labor-intensive field, and a strong, stable workforce is a precursor to our ability to provide safety, permanency, and well-being for our children and families. While we are seeing less of a health impact from COVID-19, the pandemic has spawned a new crisis that many businesses and governmental organizations are now needing to solve. The current workforce crisis has challenged our ability to rapidly assess child safety and provide timely supportive services to families. Retention and stability are critical to achieving our mission at FCCS. The nature of our work requires that we are prepared to address the child safety demands of our community, no matter the volume or timing. High turnover at the agency causes a heavier load on other workers, which can cause burnout and ultimately results in more workers leaving the agency. A loss of workers means a loss of expertise, leading to a reduced capacity for specialized case management. Comparing June 30th, 2022 to June 30th, 2021, FCCS has 57 fewer staff, most of which are direct service workers and/or direct service worker supervisors. Our data also shows that casework turnover, as a common denominator for custody cases, causes children to linger in agency custody approximately 9 months longer than children who had one caseworker working their custody case. Financially, this is an average cost of $63,000 per child over the 9-month period. More importantly, this is extending the stigma of being connected to a child welfare agency, increasing trauma associated with placement, and negatively impacting future outcomes for these youth. To help overcome this workforce crisis plaguing FCCS and others, the agency has implemented many initiatives in hopes of attracting highly qualified staff, as well as retaining them for years to come.
Thanks, Dan. I wanted to share, we're having some technical issues in terms of showing our presentation, and we're working on that internally, so hopefully that'll come up on the screen.
Oh, thank you, Laura. I got so busy, I didn't notice that.
Yeah, no worries. So FCCS is transforming our casework model design from a single caseworker model to a caseworker teaming model, which partners child welfare caseworkers, subject matter experts, support staff, and supervisors in teams to cooperatively assess and serve families. This strategy is designed to offer more comprehensive support to families, provide more resources to decisions involving child safety and risk, and to increase support and flexibility to our child welfare professionals. The teaming design is expected to support our efforts to serve families in the least restrictive manner and increase staff experience and longevity. FCCS is partnering with other child welfare agencies across Ohio and nationally, and supporting organizations who have shown interest in this child protection design. A separate but related initiative at FCCS is the development of a paraprofessional child welfare track. The paraprofessional track is a strategy to address child welfare workforce retention and recruitment, increase diversity within our workforce, increase longevity in the field, improve outcomes to children and families, and provide career advancement opportunities to employees that aspire to advance in their education and work experience. FCCS, in cooperation with local partners, is pursuing the creation of a child welfare certificate program and child protection associate's degree. Incentives will be built in to support further educational attainment to advance through the child welfare profession while being concurrently employed at FCCS. We have engaged in efforts to assess and align salaries to be more competitive to the Central Ohio market. As noted earlier, data shows us that when families have the benefit of consistency in their casework team, length of out-of-home placements are much shorter, allowing children to be safely reunified with their families. Outcomes for youth are improved and placement costs are reduced, allowing for additional reinvestment toward workforce stability strategies. FCCS has also been able to offer financial incentives to our workforce through both county and state allocations targeted to recruitment and retention. These have included sign-on incentives, recruitment incentives, and lump sum payments to our existing workforce. An additional workforce recruitment strategy being expanded is our relationship with colleges and universities to offer increased student field placements in child protection, like the existing state-funded University Partnership Program, or UPP. Our proposed design will offer paid college internships at FCCS to a broader range of colleges and universities than afforded currently by UPP. The internships will be targeted field experiences to build the specific knowledge, skills, and abilities for positions we are regularly recruiting to fill. FCCS has experienced great success in the reduction of youth experiencing placement in congregate or group care settings, as well as success in the number of youth that are safely being served in their own home with family. While we have made good progress, there are significant challenges with securing timely residential treatment for youth with complex behavioral health needs, youth with treatment needs related to developmental disabilities, and youth ordered to treatment after crossing over from the juvenile justice system. This is a challenge being experienced in every state across our country because of a significant reduction in treatment facilities dedicated to the provision of youth's behavioral health needs, coupled with a record high demand of youth needing acute interventions. Our community, like the country, has seen a reduction in these types of services for youth, including the discontinuation of multiple large residential treatment providers that once served our community's youth. The Public Children's Services Agencies of Ohio, or PCSAO, completed a placement crisis report this summer that revealed 24% of youth coming into PCSA custody were diverted from the juvenile justice system. 12% entered into PCSA custody as a result of behavioral health treatment needs, and 2.5% of youth due to the treatment needs related to significant developmental disabilities. The primary reasons cited in the report includes a lack of community alternatives to serve multi-system youth in their homes and communities, a lack of treatment foster homes willing to accept youth with complex behavioral health needs, and staffing challenges in treatment settings. While solutions are in early stages at the state level, FCCS has been engaging in numerous efforts to address these treatment and placement challenges. We have increased our per diems to treatment facilities and approved add-on reimbursements for enhanced supervision to encourage our youth's acceptance by providers, as well as increased our foster care payment rates for teens in need of placement. We have expanded contracts for community-based services to wrap services into family settings so that youth are served in their family, kin, or foster homes with additional supports and treatment. We've been able to work closely with our partner county systems to access treatment solutions for multi-system youth, in addition to local hospitals who often serve these high acuity youth in inpatient settings. FCCS has partnered with the National Youth Advocate Program to reimagine emergency shelter care within family settings rather than congregate settings, offering youth the benefit of a family coupled with therapeutic wraparound crisis support to address youth's behavioral and supervision needs. We are engaging other contracted providers to do the same, as well as engaging in efforts to expand the availability of therapeutic foster homes to serve our community's multi-system youth. Partnering with other agencies to achieve better outcomes for our children and families is at the core of what we do. No one can do this work alone. In addition to our partnerships identified above, we would like to focus on one partnership that the agency has been engaged in that is producing very positive results for some difficult to place youth. In 2017, Franklin County Children's Services, the Franklin County Board of Developmental Disabilities, and ADAM came together to address a growing need in our community. Children who were identified as multi-system youth, or children who required services from the various systems, were often housed in residential facilities. These youth had intellectual disabilities, mental health issues, and multiple behavioral diagnoses. Many of the youth were on the autism spectrum and exhibited behaviors that were difficult to control. While most had parents who wanted to remain involved, the behaviors of the children and the cost associated with residential care precluded the parents from maintaining custody. Out of the partnership with the three agencies, the multi-system youth project was created, and a 4-bedroom apartment for 4 Franklin County youth was a response to the need. The apartment is located in Kimberly Woods with 24-hour wraparound services provided by I Am Boundless, which assists young adults in their daily living, educational, community integration, and habilitation services. Today, 4 male youth have transitioned out of the apartment into adult DD units, while 4 new male youth have transitioned into the unit. We are happy to report that a 4-bedroom unit is underway for females later this year, with plans for adding 4 additional beds for younger males in the first quarter of 2023. Children who would have faced institutional care are now supported by behavioral intervention specialists with the goal of having the youth eventually return to their family, or if that's not possible, the goal is to successfully transition into the adult DD system. Again, this is an example of each agency contributing financially and forging a partnership that has shown great promise in the reduction of extreme behaviors of certain youth and better outcomes for youth involved.
Thank you, Laura. Increasing our placements with the kinship providers further assist with our current placement crisis. As identified in our agency budget spotlight, FCCS has focused our efforts on reducing our reliance on congregate care settings while increasing our placements with kinship providers and, where possible, initially placing children coming into agency custody with kin. Placement with kinship provider is vital in preserving a youth's sense of belonging and maintaining connection between the child and their family's culture and traditions, while efforts are being made to achieve reunification and permanency. Placement with kin reduces the trauma associated with removal, ensures better long-term outcomes, and has resulted in fewer disruptions in placement. Since 2017, FCCS has increased initial custody placements with our kinship providers by 12%. Also, our kinship program has grown significantly over the last several years. Since 2017, there have been a 10% shift in placement days from foster care and congregate care to providers of kinship care placements. Our kinship providers are vital to our success, but integrating a child into their home results in new or sometimes overwhelming expenses. To ensure stability of our kinship families, FCCS provides financial and material supports, which has included monthly stipends, rent and mortgage assistance, rent and mortgage assistance, childcare, summer programming, food and clothing assistance. Beginning in 2018, through collaboration with the County Department of Child and Family Services, FCCS received the Kinship Care Grant Program dollars, which supports low-income kinship families. Since inception, FCCS has provided over $5.59 million to over 1,300 families to assist with family-related needs. FCCS knows that providing financial and other assistance while a child is in agency custody provides for placement stability and better outcomes. However, having a child remain in agency custody while placed with kin can still cause trauma simply by being associated with the child welfare system. If the child cannot be reunified with their parents, legal custody or guardianship to a kinship provider is the next best option. Unfortunately, many relatives cannot afford to maintain a child in their home due to the loss of financial support provided while the child is in agency custody. To solve for this, FCCS has recently implemented the Kinship Permanency Program. The Kinship Permanency Program provides continuous financial support to a kinship provider after they take legal custody or guardianship of their children until the child turns 18 years of age or the relative no longer has legal custody, whichever comes first. The continuous financial support is a monthly stipend to assist with integrating the children in their home and provides for the stability of housing and other supports as identified in Goal 12 of the Commissioner's Rise Together Blueprint for Reducing Poverty, which is to ensure all young people are on track for long-term success by increasing the number of children in safe and stable homes and environments. Further, FCCS will set aside $1,500 per year per child to support the family for emergency needs such as rental or mortgage assistance, utility assistance, food and hard goods, to name a few. Lastly, this program is not just for kinship parents where FCCS has temporary custody. Kinship families who are providing safe and stable housing for a child where FCCS is providing in-home services are also eligible. Providing these supports will further reduce the number of children coming into agency custody, further assist with current placement crisis, and most importantly, will provide for better long-term outcomes for the child.
Good afternoon, everyone. While we continue to address our workforce and placement crisis, FCCS has also broadened its scope of response with staff and with the community around our diversity, equity, and inclusion efforts. FCCS recognizes the disproportionate impact of racism and inequality among children being referred to and supported by FCCS in-home or in-custody services. In 2017, the agency made a commitment to prioritize our DEI efforts and hired the agency's first diversity, equity, and inclusion officer. Through the focused programming of the division, which includes the evaluation department, increased efforts were aligned and targeted to specifically address racism and inequality in our communities and the children and families we serve. With DEI evaluation efforts, the agency has formally examined the issues of disproportionality specific to the agency's service impact. Specifically, a comprehensive focus has been completed to enhance our understanding, response, and programming to service provision for Black and Brown children. As a result, FCCS, through an improved RFP process, has expanded our community prevention providers by 7 for a total of 15. And out of the 15 awarded contracts, 10 are with minority-owned or minority-ran businesses, where more than $1.27 million of the total $1.48 million are awarded to minority prevention service providers. This effort has greatly expanded the ability for the children and families to be served by service providers who not only look like them, but who exhibit the level of cultural competence required to address the unique needs. We continue to explore how we intentionally meet the needs of communities with integrity, respect lived experiences, respect the dignity and worth of all youth, and demonstrate a commitment to promoting social justice. We can only meet these goals by ensuring that we take care of our best resource, our workforce. Our workforce efforts have also positively impacted the diversity of Franklin County Children's Services staff. As of last month, 37% of our caseworker and casework supervisors were Black compared to 22.5% of the county population generally. Since 2012, there has been a 141.4% increase in leaders of color. Nevertheless, Black youth make up 59% of the youth we serve, indicating a need to continue to expand our diverse hiring practices through activities like increasing our presence on minority job boards through Job Target, our partnership with NAACP's Listserv for Jobs, expanding our presence at other minority-based organizations, such as local chapters of the National Association from Black Social Workers, Black Attorneys, and Black Accountants, just to name a few. In interviewing candidates for all positions, we are more intentional that hiring panels are diverse. In 2021, we established a first of its kind unit, the Organizational Health Department, OHD, which serves as the leader in the agency's efforts to support our culture and climate change. As we continue to define our new normal in the midst of our culture change journey, it's become critically important that FCCS provides spaces for staff collaboration, authentic engagement, connection, and socialization, and with spaces that are created that foster opportunities to continue the cultivation of habits and practices that enhance our agency's climate and culture. In the next year, OHD will focus efforts on establishing strategic business partnerships with each department that support 4 core areas: culture and climate, diversity, equity, and inclusion efforts, strategy and alignment, and research and analysis. By building awareness, establishing shared language, and a common understanding, we can effectively interrupt and disrupt bias in our habits, practices, and policies. OHD external efforts will continue on enriching community partnerships through a diversity, equity, and inclusion lens, and ensuring agency accountability through goal setting and data matrix. Our approach and focus in the upcoming year will support the continuous growth and improvement of our culture, and in turn significantly impact our ability to recruit and retain qualified and diverse workforce. Thanks, team, and thank you again, commissioners, for your leadership and support. We hope you have found this information helpful, and we are open to any questions you may have for us today.
Commissioners, are there questions for Children's Services?
Sorry,
No.
I don't have any questions.
So I was trying to get off mute too. Sorry. No.
All right. Well, that would then conclude today's presentation from Franklin County Children's Services. Thank you, everyone.
Zach, just really quick. I just wanted to make mention, because we're talking about Children's Services. Would you get that, please? We are working closely with them on One Door. They have been very instrumental with our mobile unit and some other initiatives that we are working with. I just want to make sure that I mention for our levy agencies, the Board of Commissioners, Human Service agencies are working with these agencies as well across the board, and trying to share how do we assist each other with finding new talent, as well as the supportive services that we all are responsible for.
Thank you, Joy.
Well, thank you all.
Yep, thanks, Dan, and to your team for today's presentation. Commissioners, if we can take a couple-minute break, we'll get everything set up for our next hearing with Human Resources. If you're fine, we can begin at 2:35.